Daniela Faykoo-Martinez is a registered dietitian and is currently a senior patient education specialist at SeamlessMD, where she designs surgical digital care plans for patients. Daniela has a Bachelor of Applied Science in Nutrition and Food and a Master's of Health Science in Nutrition Communication from Ryerson University. Through her own experience navigating the healthcare system with her family, Daniela knows how overwhelming medical information can be for patients and believes that repeating key messages in different forms of communication is vitally important. As a dietitian in the health tech industry, Daniela enjoys applying her clinical skills and incorporating concepts such as plain language, health behavior theories, and facilitation skills to manage project teams. Her favorite part of the role is reading patients' feedback and being able to make a meaningful, measured difference in guiding patients to a safe recovery. This is Daniela's third time on the SeamlessMD podcast. Her first episode was episode number 13 on using digital patient engagement for colorectal surgery, and the second episode was number 18 for urology surgery. If you're interested in learning how SeamlessMD designs for those particular use cases, as they are quite different from thoracic surgery, go ahead and check them out. Today, however, we are very excited to have Daniela back again, this time to share more on using digital patient engagement for thoracic surgery. Daniela, welcome back to the show.
Thanks for having me, Alan and Josh.
Thanks, Daniela.
Amazing. So Daniela, thoracic surgery is a particularly interesting space for digital patient engagement, as it's a surgery specialty that has evolved quite substantially over time. Just an example of this, thoracic surgery back in the day was commonly used for treating infectious disease like tuberculosis, but then with advancements in drugs, thoracic surgeons were no longer needed for that use case, and the scope of thoracic surgery changed. Thoracic surgeons started performing surgery on things like lung cancer, esophageal procedures, foregut procedures, and even some heart procedures in some cases. On top of all this, thoracic surgery is one of the first surgery specialties to introduce robotic surgery into the mix. So we can touch on that in a little bit, but I think the main point I'm trying to make here is that progression and evolution just seems to come very naturally to thoracic surgery. And so it seems really natural that thoracic surgery would be one of the first use cases for digital patient engagement. And I think we can jump into a story on how thoracic surgery was actually one of the very first use cases for SeamlessMD. But I'll pass that story over to you guys, to Josh and Daniela.
Yeah, I can kick that off. One of our first ever partners was Michael Garron Hospital in Toronto, and we have a fantastic champion there in Dr. Carmine Simone, who's also a thoracic surgeon and the chief of surgery there. And so his specialty was on lung cancer surgery, and so that was one of the first ever programs we did. Actually, I think that was the first partner we had where we did the full pre and post-operative patient journey. So history lesson for the audience. We started off in post-discharge care on the platform. And then I think at one point, I mean, it's kind of obvious now, but it's, there's a lot of stuff for the patient to do before their surgery. And that's particularly true, for a lot of patients going through cancer surgery. So we then kind of added in the pre-operative part with Michael Garron, starting in thoracics. And I think probably one of the most memorable things for me in that program was there was actually a patient who ended up kind of chronicling his cancer journey for thoracics at Michael Garron on a blog. And he actually wrote a blog post about how, he was being given this SeamlessMD program from the hospital and what it was and the benefits and all that. So it was really cool to see, even way back, this is back in 2014, that this was something that even patients were starting to write about. So in any case, yeah, history lesson for you.
Very cool. Daniela, in terms of how the program has changed since that point in time, that was 2014. We just launched kind of a pre-operative care plan on the platform. What has changed since then? That's 6 years ago. Obviously, the platform has developed and changed over time. What are some of the new features and topics that are especially relevant today in thoracic surgery?
Yeah, I think as Seamless has continued to evolve, one of the main things I've seen from kind of like that original program to what we offer patients now is I think it's a little more detailed. So yes, like Josh said, they started to focus on the pre-op section as well, but we've also added an in-hospital section. So if patients are, staying in the hospital overnight, even if they go home same day, or even if they stay 2 days, I think we set some more expectations around what happens when you wake up and when you're in the PACU, you get transferred to your patient room, things about the different devices on the body. We also have some more sophisticated technology now. So we use a lot more logic and kind of programming algorithms to send different questions at different times, as well as track things like narcotic use and how often patients are walking and exercising. So I think Seamless has just become a lot more sophisticated.
Yeah, absolutely.
I will say, Alan, and this is probably not a sophisticated feature anymore, but one of the really neat things that Dr. Simone and Michael Garron did, which is actually, I mean, to be honest, not very common with our partners today, is he actually filmed his own videos for actually addressing a lot of the educational topics. So, Dr. Simone actually had us film him answering questions such as, what are blood thinners and, why should I stop them, X days before surgery, or, why should I stop drinking alcohol before surgery? And it actually left a really nice personal touch to their version of Seamless, which is still not that common today. I mean, not surprising probably because, getting all these different clinical providers to actually film themselves addressing these topics is a pretty
work.
Yeah, it is. And probably it's hard to update too if there's like new protocols, new information. It was actually a pretty nice touch. And I'm curious, Daniela, have you heard lately of any of our partners bringing up wanting to film themselves recording content or anything?
So I mostly get patients or clients, asking me, we don't want to reinvent the wheel. What do you have? What can we use? And that's nice because I think at Seamless right now, we're at a point where a lot of our programs are templated. We've done it so many times. We know what clients and patients need. But in terms of videos, I think it's not very common. They try to maybe add like YouTube videos that are helpful or explain things. Right now, I'm working with a hospital in Ontario called Thunder Bay Health Sciences, and they actually have videos specifically for their exercises. But that makes sense because it's hip and knee surgery. But it's not like the surgeon being like, hey, this is my face, this is what you need to expect. They do have quite a few though. It is nice.
It's funny actually. We actually had a point in the company's history where we tried filming some of our own videos, and I'm not sure, Daniela or Alan, you've seen some of those in the past. And one of the challenges that we ran into was that hospitals kept telling us, well, we do the exercise slightly differently, so we don't want to give these videos to our patients. And so I'm actually curious how there are some companies out there where they have like thousands of videos, and I think probably those are okay for maybe certain private practices who probably just don't care like how the exercise is done in the video. But I find that for a lot of hospitals where they've really invested in their I call it like their video curriculum or whatever they want to call it, they're pretty precise about how they want exercises done. So I think unfortunately that experiment didn't quite end up working out. I mean, it was worth doing to see if we could actually get everyone on the same videos. But I think we're seeing a lot lately now that people are kind of doing it their own way. Sounds like you're seeing that too, Daniela.
Yeah. I think, and patients notice, if you tell them something slightly off than with their clinical team, they'll always point it out. I think the only really time where I feel like that really worked was with the hernia team. They have the hernia collaborative in the States, and a lot of the hernia surgeons refer to their collaborative group and point all patients in that direction. So I feel like in that scenario, making videos for everyone makes sense. But otherwise, people always want personalization and edits. Videos is a tough thing, but super helpful for patients when you can get them out.
Mm-hmm. And in terms of personalizing the content for a thoracic program, let's say, maybe it's not these videos that we're reusing because there's slight adjustments needing to be made, but in terms of topics that are relevant and important to patients to cover on a thoracic program, are you able to speak to some of the unique elements that are built for thoracics as opposed to, let's say, like hernia or total joints or another program?
Yeah, absolutely. Some of the unique topics we have for thoracic patients, and again, like Alan mentioned, we have thoracic as well as some more advanced thoracic surgeries. We have thoracic and foregut on our programs. We do talk about the different types of surgical procedures. So VATS or bilateral VATS is one of the laparoscopic surgeries that are used. And that stands for, I'm going to try to say this, video assisted thoracoscopic surgery. I think we did a pretty good job there. And yeah, they just do the laparoscopic surgery either from the side or like both sides of your chest. So explaining patients, what's the difference between open, laparoscopic, VATS, or robotic surgery, I think is really helpful and unique. We also have quite a bit of information on the different types of muscle as well as nerve relaxants. Patients go home on a variety of prescriptions, and they get to learn about them. They get to learn about, what each one does. And then in their survey, when they go home, we call it like a daily health check. They actually get to track how much they're taking of each one, and if they're able to control their pain without using like so many or without using narcotics.
And I guess, Daniela, in a traditional kind of education booklet, for instance, that a patient might get, it's a two-part question, but first, would hospital programs typically include all of this information? So all these different surgery types and all the different medications and everything like that for a patient?
I would say it really varies. If you have a very specific surgery group and they do very specific surgeries, I feel like they do tend to include a lot of those details. But I've also seen it where like thoracic, there's so many surgeries. So sometimes the booklet, because it's given to everyone, it's a little more generic.
Right.
So they might just like list 20 medications and you kind of just got to figure it out. So on Seamless, we just try to give patients what information pertains to them, make it more specific.
Yeah. And I think that point's really crucial to make, because, maybe there is a team out there that's giving a booklet with everything in it, but it's got to be overwhelming for patients to actually, they hear their diagnosis and maybe the information that they get right then and there at that meeting kind of goes over their head, and they're just totally overwhelmed with the diagnosis. And then they jump into maybe an education booklet and it's, 50, 60 pages of education. So how does digital patient engagement change that experience for patients, or how have you designed SeamlessMD to change the experience for our thoracic patients?
I think what you said was on point. Like a lot of patients are very overwhelmed, and some of the feedback I've even gotten was like, "Thank you, this really broke it down." And I think part of designing these programs is really anticipating patients' needs. So after surgery, maybe someone with that needs some sort of mass resected or you're like taken out of their chest, they're coming in with shortness of breath and they're expecting to go into the surgery and come out and be able to breathe easier. But the truth is, after thoracic surgery, it's actually kind of hard to breathe. And you have to learn, you have to do your exercises, you got to take it easy, deep breaths. So there are actually quite a lot of breathing exercises and sometimes even different devices to do those exercises. So, like if a patient's given 13 exercises to do after surgery, we take that and we break it down. One exercise per page, pictures, simple descriptions, and especially with dynamic exercises, I always include videos where we can. I know we're just talking about videos. I think that's super, super important. And it's just easy to understand. If you don't have a vision impairment, videos I think are definitely a great way to go. I also just want to say that with the exercises, and a lot of patients have concerns about the pain they feel and maybe the stiffness. So again, just normalizing what it's like after surgery, I think is really key.
Yeah, and I think it comes to mind for me is especially for like thoracics, you might wake up with something like a chest tube and maybe also a feeding tube, and I'm sure you get some education on that, but when you're kind of pretty knocked up on pain medications and you're being educated at 6 in the morning, like I've heard it's very hard to remember that information when you go home. So I know Daniela, you and the team have put a lot of effort into having that sort of interactive content on the platform around things like chest tubes and feeding tubes and all that.
Yeah, absolutely. Even patients have come back and said like, "Thank you for helping me figure out when I had a problem with my chest tube in the daily health check, because otherwise they wouldn't have known." And other patients have actually said like, "This is so convenient." It's on their device, their mobile device. If they use it on their phone, it's not just on their phone, but if they do, it's perfect. You take it around with you. You go out. You can always reference things. You can do a health check. Maybe when you're just feeling bad, it's really up to you how you want to use it. So,
Yeah, I also wanted to ask, because I know that you've done work designing programs for esophagectomies as well, and then we've heard from thoracic programs that those are some of the most complicated like recoveries for patients. They have a really high risk of readmissions and ER visits. Is there anything special for those programs that we've designed?
yes, that is a whole different group of thoracic patients, the esophagectomies. We actually do include some esophageal surgeries on our thoracic foregut line, but with the esophagectomies specifically, particularly the group we worked with, they were going home on a tube feed. And that's a really different experience for patients. Imagine, maybe you have some chest tubes for drainage, you have a feeding tube, you have to learn, how to hang it up, how to use this whole pole, there's a lot of like troubleshooting with tube feeding. Particularly, like I love the topic because I'm a dietitian, it's kind of fun for me. But for patients, like learning how to change the rate, maybe switching formula, there's like lots of different things to learn. So I would say that is one of the biggest things for patients, is their diet, their tube feeding, and then transitioning to regular food when they're ready.
And Daniela, you mentioned that videos, for instance, are a really good support system or a good visual information delivery of certain key messages. In terms of finding out if there's a problem with a patient's chest tube, or finding out if they are actually complying with some of their breathing exercises and things like that, are there certain design elements or topics that you've incorporated into those health checks that kind of preempt some of the potential problems that would come up for a patient?
Yeah, the way we've designed the health check is actually first we ask patients if they have a chest tube, because not everyone does. Sometimes patients have multiple of them. So we often ask, like, did you go home with a chest tube? And we actually show a picture of this is what it looks like. And then if they indicate yes, whenever they do a health check, we ask them the different signs of infection is mostly, how much output they're getting, is it red or swollen? Does it hurt? Any kind of abnormalities they might have, we just give them a list and then they get to check off, anything that's worrisome. And based on their answer, we actually tell them, hey, this is pretty concerning. You should call your surgery team. That's kind of how it works for the chest tube. Did you mention another item?
I didn't specifically. I was just saying compliance around certain protocols, like their breathing exercise, for instance. Is there a way to track that for if a patient's actually done that step?
Yeah, we actually ask two different important things. We ask how much trouble they're having breathing. So we kind of have about three, I would say like three options, like a little trouble breathing when I'm lying down. It's a little more concerning, or like I can barely breathe. So based on that, we give patients recommendations. We ask them if they've done their exercise, and if not, like, why haven't they done their exercise? I found with this patient population, they tend to be quite tired. And their pain management, like it's hard to do the breathing exercise when you have a lot of pain, and you kind of have to push through that. So we definitely encourage patients that way, and then track it through the survey.
Right, got it. It's neat as well. So kind of the takeaway that I've got is there's almost like this branching logic element to the platform, where if a patient indicates, yes, I have a chest tube, then they're going to get chest tube information. Does the same thing happen with the education that you're pushing out to patients? So not just the survey questions that we ask, but the actual education that's being either sent in an email or a text message to a patient. How does that kind of branching logic work?
Yeah, I before I mentioned anticipating patient needs. So one of the first things we ask patients when they get put on Seamless is what's your sex? So if anyone indicates that they are female, we actually let them know that after surgery, they might want to consider wearing a sports bra or like a wrap, or like no bra at all. Because if your incision, is in your chest area, and then you're wearing a bra with an underwire, can actually cause quite a lot of pain. So I think that's just one of the very simple but super helpful ways that we use that kind of logic to give patients the information they need after surgery.
So it sounds like there's like very specific education that it would be, that's obviously pertaining to most likely a woman who has a bra. And I imagine there's other education that's like very specific to a patient who has a chest tube and, had this type of surgery performed.
Yeah, another good example is, with our lobectomy patients, if they're coming in with shortness of breath, there is some evidence that shows patients can follow like a lower carb diet before surgery, and that might help alleviate some of those breathing symptoms. So we offer that for that population. And then for patients who have had surgery on their esophagus, we actually help them transition from like clear fluids to full fluids to soft foods to regular foods after surgery, sorry.
Right, and the platform is changing along with the patient's journey. So if it's like the first week after surgery, they're getting this information. For let's say like a liquid diet, and then it moves on based on where they are? Is that kind of how it works?
Exactly. Because we have the surgery's patient, we have the patient's surgery date, we can actually time it. And often these sorts of transitions are very specific. So it's like week 1, you do this, week 2, you do that. So every week we send patients reminders like, hey, if you're ready to transition to the next stage of your diet, this is what you can do. These are the foods you can eat. This is the way to prepare the food. And these are some symptoms to look out for, because a lot of the foregut patients do have digestive tract issues, reflux, heartburn, things like that. So we help patients monitor for those symptoms.
Hey, Daniela, so I know that like at this point, we have some pretty robust template digital care plans for these different surgeries or conditions. So let's say for maybe thoracics. And you mentioned, I think about a minute ago, that sometimes there are these maybe, newer evidence-based protocols for what patients should do. And probably some of those are in our templates. I was curious, do you ever run across, clinical partners where maybe some of the things that are in our templates aren't really things that they do just yet, but they go, oh, that's actually a really good idea. Yeah, let's use that. And then maybe Seamless is kind of the vehicle that's delivering that part of a protocol for the first time in the hospital. Does that happen often?
Yes, it does. When we start an implementation process, or we start developing one of these programs with a hospital partner, we actually have a very thorough checklist. And I kind of have all the options that people might want for that specific surgery. So often things that, we discuss and kind of lead to this kind of conversation are things like carb loading, chlorhexidine showers. Those are kind of the things that are optional before surgery. Some people want them, some people don't. And it's often a time where especially when you have the surgeons online, they're like, oh, we've been thinking about implementing this. Or like, oh, we really want to go the ERAS route. Like, give us a couple weeks to figure it out. We'll get all the surgeons on board. And it actually helps to facilitate that conversation and help them standardize their protocol. The more standardized the hospitals have their protocol, the better it is for patients, I would say, because it's more consistent information. Before surgery, when they're in the hospital, and then when they go home, they're often seeing like a lot of different professionals. And sometimes they get conflicting information.
So what you're saying is that maybe we should consider creating our own line of chlorhexidine washes, maybe some carb loading products, and then we could be
push that out.
Here's the app, and here's your product, like one care package. That would be so convenient.
Yeah.
So this would be like what would you call it? Seamless recovery drink, or what would you want to call it, Danielle, if you could brand the carb loading product?
I mean, I care more about what's in the carb loading product, because a lot of patients are giving Gatorade, and it's not even the right concentration.
Right.
So
yeah. we'll leave the branding to Alan then.
Exactly.
Yeah, I mean, my brain instantly just went to alliteration. I was like, seamless simple sugars, but to Daniela's point, simple sugars is not the right thing that we want to.
You're gonna freak patients out. Like, my husband keeps telling me to drink sugar.
Hey, Alan, how about seamless surgery supplements? Is that too basic?
That's good. No, that's good. That's good. I like that. That's
funny. Seamless surgery supplements.
Yeah. Daniela, from some of the enhanced recovery groups that I've talked with about thoracic surgery, another thing that they seem to really emphasize the value of in a digital program is collecting certain patient-reported outcomes that are especially relevant to enhanced recovery. So things like opioid consumption, for instance, or even compliance, like their wash before surgery and things like that. In terms of a patient-reported outcome, is there anything that's kind of unique to thoracic surgery that we can collect, like around their breathing ability or anything like that compared to other surgery types?
I would say patient compliance with their exercises is a big one, including walking, not just their breathing exercises. I'd also, I don't know if this is ERAS, but I just feel like their pain is so important, and it's so obvious to them. Like, they have to breathe every day, all day, and it hurts. So I just think like tracking their pain is super important. It's not ERAS, but it is really important.
Right.
Yeah.
And I think the other thing that I've seen from the platform is it's not just the healthcare providers that can track pain, but it's also, there's a progress tracker for patients to view as well, if I'm not mistaken.
Yeah, yeah. And patients really like the visualization of it. So the survey is available for 30 days after surgery. So you can literally put in an answer every day and it'll plot your pain. It's like pain versus time. So a lot of times patients really like to see their pain going down over time. It's kind of like a good reinforcement that like, hey, I'm healing, I'm feeling better. And we also offer that for anxiety, mood, and anything else that's maybe relevant to their healing.
In terms of kind of common feedback that you've heard from patients, obviously, the first thoracic use case, like Josh mentioned, was back in 2014 with digital patient engagement or with SeamlessMD really. What have thoracic patients been saying all the way up to 2020 now? I know you collect feedback all the time. Is there common themes that you're finding?
Yes, I feel like they're a very detail-oriented group. So we've gotten some really detailed feedback, like, you told me everything I need to know before surgery, including you gave me the driving instructions. This is great. I would even prefer an extra reminder before surgery. Like, okay, great. I'm so glad that, that was helpful for you. This was really cool. It told you what to expect and why. It also told you the benefits of why you should do certain things. So to me, working in patient education, that's so important. I know from a health behavior change standpoint that adults need to know why they need to do something or they're not going to do it. So we really work hard to always include the rationales. And I'm so glad patients like saw that and was like, yeah, it actually helped me follow through and be more compliant. I think another really some funny feedback we got, and we're always learning, surgical teams are always learning. This happened kind of like with our foregut group. They were asking patients to brush their teeth 2 to 3 times before surgery and then again after surgery, and they wanted to track compliance. And a lot of patients weren't doing it. And then when they don't do something, we always ask, what barriers did you have? And some funny feedback we got from patients was that they actually didn't have teeth. So they couldn't brush their teeth because they didn't have it. So I think that'll be some really interesting feedback to give the surgical group, but also just for ourselves, like making sure we have all the options for patients. What does oral care look like for someone who has teeth and who doesn't have teeth and maybe has dentures? I just thought that was really, I hadn't come across that before, so I thought that was really interesting.
That is cool. I like the idea that you can collect that patient feedback. You can collect the patient voice now. It's not just a one-way street for education just being delivered to patients, but you can actually see what patients are saying and understand the things that they like and how they're progressing in their recovery, things like that.
Yeah, we're always iterating. We launch programs, they go live, and then clients come back with maybe changes in protocols, or we review the feedback and find things like this about patients who don't have teeth, then we got to make updates. So we launch it and then we're always updating to keep it relevant for patients.
And I think that's one of the main benefits of software and technology is just the iteration process and how it just keeps improving over time.
Exactly.
That's awesome.
Exactly. Yeah.
So at this point, Daniela, we've been on for a good while. So we're going to transition over to our Fast 5 lightning round, where basically we ask you 5 questions. You've done this before, but just for the audience to know, we ask you 5 questions to get to know you a bit better. You can answer these questions as concisely as you'd like. I'm going to jump right in with number 1. So aside from your basic necessities, what do you need to do every day to be happy?
Okay. I had to look up what basic necessities were because I didn't really know what was included. But so other than basic necessities, I would say I always need heat to be happy because I'm always cold. And it's not within the basic necessities group because I've actually been to countries where they don't have heat and it's been so cold and so uncomfortable.
Oh gosh.
So connectedness, I definitely need family, friends, pets, people around me. I don't like being by myself. A little more vain, I definitely need my concealer every day. I've been wearing concealer every day since probably like grade 7. And yeah, even like when I've done like 5-day hikes, I wake up at like 3:30 because usually you start around like 4 or 5, and I'll just put concealer on and then I'm good to go.
Oh my gosh, even when you're camping or?
Yeah, because like you're taking pictures and stuff, right? I don't know.
Yeah.
Okay, so I just Googled concealer just to make sure I knew what you were talking about.
I was gonna say I don't think I've ever worn it, but you're close.
You guys got what it is.
Yeah.
I mean, I've heard the
Upper
word
blemishes.
foundation. Is it foundation? Is that the same thing or?
So concealer is like foundation, but more opaque.
Ah, okay.
So
Wait.
I have a vague sense.
Does it make sense to you, Alan? Wait, so what is foundation for then?
So foundation is usually like
It sounds yeah. We'll save this for another podcast. Yeah.
foundation is your whole face, and concealer is spot.
Okay. I see.
Okay.
I see.
Okay.
So,
my list.
Daniela, if we can get you a sponsorship from a
Some makeup company.
yeah, makeup company of your choice, who would that be?
Yeah.
Tarte.
Hmm?
They're
What's that
called Tarte.
Tarte?
Tarte.
Tarte.
Gosh, I don't know anyone.
It sounds like a bakery. Sounds like a bakery to me.
Okay, I have 2 more items on my list. I also just need plants and I need my yerba mate. That's it.
Ah, yes, of course, yerba mate. That's great. Okay. Second question. I'm gonna throw a bait and switch at you. So you've actually not seen this question ever before, but if you could travel to any location or time in history and live there for 1 week, what would you pick and why?
There was this series on Netflix that I really liked. It was about Jack the Ripper, and it just seemed like a really cool time.
Huh.
So maybe there. I don't know. I don't even know what that is. Like early 1900s. I have no idea.
But like in the same city as Jack the Ripper, or do you mean like far away from Jack the Ripper?
You're right. That sounds like a really bad idea. I could get murdered. But I don't know. That was just like so intense. Like, I don't know. There was some intense serial killing going on. So it might be interesting to be. Maybe that's a bad idea. I don't know.
Wait, unless you want to be the detective who catches Jack the Ripper.
Huh?
Unless you're willing to be the detective to catch Jack the Ripper.
No, that seems very dangerous. Okay, I guess I want to be on the outskirts of the town where they caught Jack the Ripper, just so you know I could like see what's going on.
You want to read it in the newspaper, but you don't really want to have to like be around it.
Yeah, also it just seems cool, like cobblestone, small streets, market life.
Yeah,
I like it.
Definitely. Cool. Question number 3. What is one of your fondest memories from childhood?
I would say strawberry picking with my family. The idea of like eating warm strawberries from the field, picking more than you eat, or eating more than you pick. Whoops. Yeah, it was just some good memories.
Definitely, yeah. Number 4, what, if anything, is too serious to joke about?
I feel really strongly about this. I feel like it's not appropriate to joke about people with disabilities. Growing up, people, I don't know if it was like a Jim Carrey thing, but people growing up would always like mock people with autism and, you know, maybe their different movements and stuff. And that never sat well with me. But it was like a thing. Everyone did it around me anyway. And then I had a stutter as a kid, and people loved to make fun of me. And it was very frustrating because I was already frustrated that I couldn't get the word out. And then they're mocking me. So that really, no.
Yeah, definitely.
It's kind of weird. I find that like growing up, kids can be really cruel sometimes, but I think most kids end up maturing pretty well. And like when you meet them as adults, I mean, not for everyone, but a lot of people, you kind of like ask yourself, wow, like this person's not the same as they were 10, 15, 20 years ago. Yeah, kids can be really cruel.
I mean, I was pretty mean, but I didn't make fun of kids with disabilities.
Right. No, I think there's definitely a lack of empathy at, you know, certain ages, and they just don't even understand that what they're saying, even though they may be saying it to get a laugh from even themselves or other people, but they don't realize, like, put yourself in their shoes, like actually, you know, have a disability. What is that like?
Do you think that's better now, like in schools today, in terms of empathy among kids and like being better educated, whether from parents or from teachers, about like different things going on?
I feel like it's less socially accepted, but I think the internet also gives people another way to like be mean and not like, I don't know. I feel like bullying's always been a thing, but like cyberbullying apparently is worse than ever. So
that's true.
I think it probably still happens.
Yeah, I wonder, like, obviously I don't hang around a lot of schools or kids, so I don't know exactly.
Obviously.
But I think it is kind of neat as well if you look at like TV and movies, how certain social things have changed. Like for instance, you take the show Friends, which was like obviously very big in the 90s, and there are certain things in Friends that are not accepted today. And how that's kind of changed. So maybe with the influence of media as well, because kids like myself, I grew up on TV and movies, and that was kind of my childhood. And so I feel like kids today are kind of growing up with a new standard as well in that regard as well. So potentially it's changed.
Yeah, I'd agree.
Yeah. All right, last question, Daniela. If you weren't in healthcare, what would you be doing?
It changes every week. This week, I would like to be a professional organizer. I found out it's a real job. You can make money.
Like, is this like a personal consultant organizer, or how does that work usually?
Yeah, like you would be like, oh, Daniela, I need you to come organize my closet. And I would come, help you purge, maybe set up a new closet system, you know, like rearrange your rooms, it's more functional. And then it would be beautiful, functional, and then you would pay me.
Oh, so this is more like organizing space, or does this also extend to like organize my life?
Oh, I'm not a life coach. No, just things.
Just
Things.
like that. Physical thing. What about like my email inbox? You could organize that, or oh no, okay.
I literally I think of myself as a very organized person, but my emails, like no. I don't like to organize. I don't like to. No, I leave them all on red. There's like a million notifications.
Interesting.
Yeah, I'm really bad with that. But otherwise, like my closets and stuff are organized. Pantries.
There you go. If only you could get paid for that now.
Yeah.
Exactly. Apparently you can.
Apparently you can. Cool. Well, awesome, Daniela. We'll cap it here. It's been a fantastic episode, getting to learn more about using digital patient engagement for thoracic surgery, as well as just learning more about yourself. I think that's always entertaining to all of our podcast listeners.
Do you ever do the reverse, Alan? Does anyone get to ask you the fast 5 questions?
You are more than welcome to ask me the fast five. I've never said you can't do that, but no one so far has done that. So maybe on your 4th episode coming up.
Wow. Well, hold on. He now that he said it, if you come on again, Daniela, then you can ask.
That's right.
I have to ask them.
Actually,
yeah.
we'll make that a thing. If you
and
come
actually,
back
Daniela, you should
episode,
decide the fast 5 questions.
Yeah.
I get to decide?
Yeah. You don't have to send them to me in advance. They'll just answer them on the spot.
Yeah, but you're going to edit it out anyways.
We'll see.
Right.
But awesome. Daniela, thank you so much for joining today. I had a blast.
Thanks for having me, guys.
No problem. Bye, Daniela.
Adios.
See ya.